That was awesome. Thank you so much, Dr. Singh. It's a
Hey.
pleasure.
Oh, my pleasure.
So Doc, I'm looking to get a knee replacement. So when you said something about hip replacement, should I do bilateral? Should I get them both done at the same time?
No, never do that. No, never do the knee replacement at the same time. You're going to be miserable. You're going to be the recovery is going to be horrible for you. Do one at a time.
And who do you recommend? Because I was online trying to find. I went to HHS. I hate that hospital. I hate it. Hate it. I know they're supposed to be the best in the world. I don't know. I just had bad feelings there. Something about, and then there was a doctor that was recommended, and he was so flippant. And I know he's one of the best, but his vibe wasn't right. I need somebody that can deal with me. You know.
So I can tell you who did mine.
You had a knee replacement?
Knee reconstruction. So I had my knees reconstructed over 25 years ago because of trauma. You know, I used to kickbox, I used to ski, you know, I was an alternate for the US karate team in 1984 Olympics. You know, so I mean, I've had a lot of trauma.
Don't get it twisted. Oh.
No. So I had them reconstructed when I was still relatively young and healthy. You know, and 25 years, 25 years later, I'm still, knock on wood, healthy because I, work out, try to maintain the weight, even though I put on some, but for the most part, the guy who did mine is at Lenox Hill now. He used to be at Beth Israel North. It used to be called the Doctor's Hospital when I had it done. It was across from Gracie Mansion, but that hospital was then closed, and the entire team that was there, that was a team. They were the team surgeons for the Knicks and the Rangers and the U.S. Back then, it was the U.S. Dream Team, the basketball Dream Team, are now at Lenox Hill. Okay. His name is Gil Scuderi, and I'll send you his telephone number.
Thank you.
And he is
old now? Like, is he rickety?
No. He was young. So it was the Scott Kelly Insall Institute for Sports Medicine, and Dr. Scott and Dr. Kelly were the older ones. And Gil Scuderi was the young kid on the block, but he was super brilliant. I mean, so I purposely chose the young guy to do the surgery, not the older guys, even though they had more experience, because he was so humble. He was so down to earth. He talked to me like a person. And I was a doctor. I was a resident in training at that time in a different hospital, but he treated me with such kindness, gave me all the information. He didn't push me, didn't rush me. And the sense I had from him, and today he's the chief of orthopedics for a reason.
I'm going to ask you a sensitive question.
Sure.
So you're still a man, right?
Yeah.
I'm a Black woman.
Yes.
And these are things that I never considered before, but now it's absolutely a consideration when I'm going to a doctor, because how he treats you and how he treats me may be completely different. You know what I'm saying?
No, I think I do hear you. But realize something. I'm brown. It may not be a woman. I'm not Black.
Except you're not Mexican. You're Indian, and Asians are considered different.
Right, adjacent.
I think so. Oh, okay. But Gil, for the most part, and I've talked to Gil since then. He is, for the most part, a true gentleman. He's a consummate doctor. To him, I can't speak to the fact that he is colorblind, but he doesn't look at race the same exact way that somebody else might. Okay. He really cares about his patients, and he treats all his patients as an individual. Okay. Looking at your medical needs, he will take, of course, if for some reason race has a component to a particular problem, right, then of course he will address that component, but he won't take race as the sole determining factor for a treatment option.
Okay, I'm going to pray about it, and when I connect, my spirit will know. So let's deal with Tonya getting this weight off, because she needs. No, we're going to get this weight off, Tonya, because you mentioned it twice now, so I know that you do it. She just got off of sugar for a week. I don't know if that have an impact on losing weight.
So quickly, it may not.
Spoke to everything I said. I stay up late. I eat carbs to keep my brain going, because I start wanting to work and I never get tired. I have more energy than any person on the planet.
Because it's the carbs.
I get up at 5 in the morning. I walk for 6 miles. I go to the gym. I have a trainer, and I stay up all night long. I get about 3 hours of sleep.
But it's amazing. With 3 hours of sleep, you're this energetic. So clearly something is working. Okay, let's just say that. Let's just say that. Because people who have 3 hours of sleep are so sleep deprived because the normal amount of time that people, adults require is anywhere from 7 to 8 hours of sleep and good quality sleep. But if you can function this way and you can look this good and this peppy, with 3 hours of sleep, God bless you. Then you need to figure out how we can kind of how we can harness all this energy and make you more productive, in the 4 hours that you should be sleeping that you're not, instead of just sitting there awake, waiting to fall asleep.
Oh, I'm not waiting to fall asleep because when I'm ready to go to sleep, I lay down, I put my little night hood on, I go to sleep. But
Good.
there's so much to do. There's so much to read. There's so
I
much to
know.
see. Like I have to make myself go to sleep because there's
Yeah.
enough to keep you entertained and engaged
Oh,
forever.
absolutely.
So that's what I'm doing. I've
So
got off the
even
sugar.
though, so that's perfect. You have to kind of wean yourself off of sugar because it's a sugar that gives you that energy, the burst of energy, because it's not sustained energy, right? So you have sugar that gives you burst of energy, but then also you get a carbo crash. Protein's what gives you long sustained energy. So if you can kind of wean yourself off the sugars, you will notice that you won't be as, energetic because you won't get that constant blood sugar rush, you know.
I'm energetic. I haven't had sugar for 4 days.
Oh my God, this is you without sugar for 4 days. I need to kind of like figure out, I need to study you more because you need to package that and give it to people.
So my
It's really
question is
amazing.
this thing on? So my question is the weight, Tanya, a problem? Because you seem healthy, energetic, you're happy, you seem so.
My doctor told me that my bad cholesterols were so bad that she was like, you must see a cardiologist. You must go on medication. I'm like, not happening.
Yeah, unfortunately, the medications
Not happening.
for cholesterol, right? Medication for cholesterols especially for me, I can tell you, and a lot of people I know, it gives you muscle cramps.
Ooh.
Yeah, it gives you muscle cramps. I'm like, I can't do the things I want to do because my muscles are cramping just because I want to control my triglycerides. So diet is one. Unfortunately, our body makes cholesterol our body makes cholesterol. It's natural to us. And how much we take on top of it and how we process it's the other component to it. So don't forget, there's genetic link to high cholesterol. We make cholesterol, and in some cases we make more than what we should have. But we shouldn't be compounding it by adding on more cholesterol by the kind of foods we eat that we can't process well, you know. So
I think I tweeted out the wrong thing. The apnea site, somebody was asking, I'm sorry.
it's www.app-nea.com.
Oh, it's the dash, I forgot. Okay.
Yeah.
So
So for Tanya, I think the best thing to do, Tanya, is, your mind is running at 1,000 miles an hour and you want to catch up with it but you have to kind of force yourself to not catch up. You have to force yourself to say, okay, I'm going to put myself on a high sleep hygiene. That means I'm going to try, and don't do it like a crash course. So right now you get 3 hours. It's going to be almost impossible for me to tell you, try to increase it by 100%, try to get 6 hours of sleep. You're not going to do it. So go from 3 to 4, 4 to 5, and like you're, weaning yourself off of sugar, try it for a week at a time. So try to think about, in a month's time, I want to be able to get to 7 hours of sleep. So every week I'm going to add on 1 hour and give myself 1 week to kind of get acclimated to it. And then I'll add another hour. And by the time I'll get 7 hours, I'm good. And then if I need to get 8 hours, great. More than 8 is bad. Less than 7 is bad, because it's not just you're this energetic at 3 hours. It's not the duration of sleep. It's also it's not just 3 hours. It's also the 7 hours. What happens to your physiology? And this is the other thing with the Alzheimer's, right? In our circulatory system, we have a venous system, an arterial system, and a lymphatic system, right? Arteries bring blood into the organ. Veins take the carbon dioxide laden blood away from the organ and into the lungs, so it can get mixed with oxygen again and recirculated. And the lymphatic system kind of drains all the infections and the toxins away. Do you know that's everywhere? It's true in the rest of the body except for one organ, the brain. The brain doesn't have a lymphatic system. It only has an arterial system. The carotid arteries are the only source of oxygen to the brain, blood and oxygen. And the jugular vein is the only way for the blood to kind of get away from the brain. So how does the brain clear itself, all the metabolites, all the metabolic byproducts? You know, only at night, only at night, and
Mm.
only during sleep is there some system called the glymphatic system, not the lymphatic system.
Lymphatic. Okay.
Only during sleep is that glymphatic system active. That means that's the only time the brain takes the active metabolites, the waste products from all of its day's work, and it clears it from the brain. And when it doesn't clear it, like dirty a house, it it layers on these byproducts called beta amyloid proteins, which is linked directly to Alzheimer's. And this new drug that came out 2 days ago by Bayer, it it only targets the manufacturing of beta amyloids. It actually slows down the production of the beta amyloids. But beta amyloids are a byproduct of the daily metabolites of the brain activity, right? So if you don't sleep, it doesn't get cleared away naturally. So tell me, sleep doesn't cost anything. It's a free, physiologic need. You don't have to spend a dime on getting sleep. But this new medication is 50 something $1,000 a month to treat. You tell me, you're trying to, somebody who's got underlying factors that are causing the beta amyloids to form. Now you're taking these drugs to slow down the progression. Why don't you just get sleep? Why don't you just maintain a healthy lifestyle that can actually slow down the natural production of these beta amyloids, which is a natural product? Just slow it down naturally by doing all the right things, eating the right foods, maintaining a healthy lifestyle, getting enough sleep of long enough duration that the brain clears itself of these metabolites. 3 hours is not enough time, my dear. You need the 7 to 8 hours, because you can't clean a full house in 1 hour, can you? You need time, and the brain works the same way. So you just need that time for the brain to be at complete rest, so that this lymphatic system can do its job and clear the active metabolites like the beta amyloids from the brain, so that the brain for the next day, you don't have the brain fog, so you're clear. And this doesn't happen in a short amount of time. This happens over years. This layering on. After a while, you don't even see your desk because it's so full of dust that you don't even see it. And brain is nothing more than a bunch of neurons, synapses that are communicating with each other. And if you lay down this proteolytic enzyme, this plaque, just like you get plaque around the teeth, this plaque sticks on top of the brain cells, and it prevents the migration or the transmission of the synapses, the transmission of nerve impulses from one synaptic junction to the next synaptic junction, because that junction is all clogged up with the beta amyloids. So for you, my dear, I know you have a hard time getting to sleep, but you have to kind of wean yourself into.
I don't have a hard time getting to sleep. I can go to sleep. I'm
Then
just excited by life.
Then you just have to mentally say to yourself, I have to get the 7 hours of sleep. If you don't have a problem falling asleep, they're unlike some people who have something called insomnia, where they could stay in bed, lying awake, waiting to fall asleep, and they can't fall asleep. You don't have that problem. So you're so fortunate, because for that, you have to give them pills to make them fall asleep, but in your case, you just have to kind of say to yourself, I'm just going to go to bed, turn the lights off, no reading, put the mask on, have some beautiful smelling, wonderful smelling, incense that kind of give me great joy. And
I have sage and lavender and sage and frankincense sprays that I spray on the bed. I got candles, but I'm going to make a discipline of going to bed at a certain time.
That's what it is.
And that's what I will try. Thank you so much.
Because and you will notice that once you get the necessary sleep, the amount of sleep, the craving for carbohydrates, the binge eating that you do at night won't be there, because the hormones will start to auto-regulate. The leptin, which makes you, and the ghrelin, one that makes you want to eat, the other one kind of gives you a feeling of fulfillment, so you're full, will start to auto-regulate and you won't have that craving.
May it be so. Thank you so much, Dr. Singh.
Hey, Dr. Singh, appreciate you giving us this extra dose of goodness.
Of course, anything for you.
Oh, I feel so good.
You've been so kind
No, you are
for
awesome.
having me on your show.
It's a pleasure, and you bring it all the time. So thank you for taking this extra time and for with us. And thank
Love
you,
it.
Tanya. I appreciate you.
Yeah,
Thank
Tanya,
you
and
so
feel free, if you have anything, Karen has my email address, feel free to email or call me because she has my cell phone number as well. If I can be of any help, please do not hesitate. It'll be my pleasure.
All right.
You're welcome.
Thank you. Thank you, everyone.
Love you guys. All right. See you next week.
Bye, everybody.
You
Thank
coming
you.
next week?
Yep. See you next week.
All right. Bye, Dr. Singh.
Bye.
Bye, Lindsay. What?
I had two things for you.
Okay.
Now they're gone.
Oh, see, you need more sleep.